everyone, my name is Amber Arif and I'm your trainer for today's topic, which is essential first aid procedure in childcare. So creating a safe and responsive environment, every minute counts. Your knowledge is child safety net. This session will go about 30 minutes. Training equips with your essential skill to respond confidently and effectively in emergencies. So we're going to talk about the first aid, CPR, AED, adult, child and infant training. So before we begin our training session, I would like to do the acknowledgement of country. We acknowledge the Aboriginal people as the traditional owner of this land, and we pay our respect to elders past and present. So let's go through with some classroom rules, which is participate actively in discussion, ask questions if anything is unclear, practice the techniques during demonstration, respect others' contribution, please silence your mobile phones during the session. So the learning objective, we are looking through this training. By the end of the session, participants will be able to recognizing the emergency situation, identify situation recurring immediate first aid response, and assess scene safety, perform basic CPR, demonstrate proper hand placement, compression depth and rhythm of effective CPR, treat common injuries, apply appropriate first aid in wound, burn, fracture and sprain, know when to call for help. So recognize the situation, recurring professional and medical assistance. So let's have a look at the session overview and core principle. So we're going to be talking about the Dr. ABCD framework. So the systematic approach to emergency response is danger assessment, response check, send for help, airway opening, breathing check, compression, and defibrillation. So legal and ethical duty, essential responsibility in first aid, obtain consent where possible, duty of care to the child, maintain confidentiality, document incidents, act with your competence. Child-centric care, ensuring the casualty feels safe and supported, calm, reassuring communication, maintain eye contact, protect privacy and dignity, use simple and appropriate language. When we talk about food safety integration, what we need to keep in mind, managing food-related emergencies, for example, choking, prevention strategy, allergic reactions recognition, EpiPen administration, and hygiene in emergency response. So performing CPRs adhering to the ARC guidelines. So compression to breath ratio. So when we're doing the compression, we are looking for 30 compressions with 2 breaths. So 30 compression to 2 breaths in single rescuer. So compression rate to depth. So rated 100 to 120 minute compression per minute. Depth, child approximately 1/3 of chest depth. Infant 5 centimeters or the 1/3 of chest depth. Hand placement, so middle of the chest between the nipples. So when you looking at the adult, so you just need to measure it from the armpit. Yeah. So you need to drag your arm from the armpit to the middle of the chest, just right here. So because you're not going to have the measuring tape on that time to measure it properly. So measure it for the adult or any children like above the age of 12. So you can just measure with the armpit. So the child until you're 8 years old, use 1 or 2 hand, adjust depth accordingly. With infant under 1 year old, you just need to use 2 fingers, gentlest compression. So you're just not going to be compressing too hard on them because they're too little. Techniques, ensure proper hand position and maintain the compressions. So when to stop CPR? Professional help arrives and takes over. The child shows sign of life, so they started to breathe like normally. Or if you're exhausted and now cannot continue, the scene become unsafe. So you can stop in that situation. Why we say you need to stop when you get exhausted? Because there's no point if you're too tired, you're not going to be putting enough pressure for the compression. So if someone beside you, or if you can ask help for someone, so you can you can rotate and you can take turn. So systematic first aid, the doctor DRS ABCD action plan. So when we say D, so D is for check for and remove any danger to yourself, the child and the bystanders. Ensure the scene is safe and before approaching. Response, check if the child responds. Gently switch shoulders and ask, are you okay? Look for any movement or any response. Send for help. Call 000 or local emergency number immediately. Provide clear information about the location and the nature of the emergency and how many people are involved in that emergency situation. So, A is for airways. Open the airways using head tilt and chin lift technique. Remove any visible obstructions from the mouth. B is stand for breathing. Check the normal breathing by looking, listening and feel for no more than 10 seconds. Look for the chest rise and fall. Compressions. If not breathing normally, start CPR immediately. Follow the 30:2 compression ratio to breathe ratio at 100 to 120 compressions per minute. Defibrillation, attached and automatic external defibrillation if available. Follow the voice prompt and provide accordingly to the instructions. So when we talk about the first in childcare or first in children, so what we look for? So the first emergency, it could be like choking, so choking on an object. Unconscious casualty, administer CPR, use an automatic defibrillator recovery position, and asthma attack. So you need to find out what exactly the emergency is. Yeah. Care beyond the physical, consent and support, ensuring safety and support. Create an environment where the child feels secure and cared for, speaking calmly and reassuring in a gentle tone. Maintain eye contact and use simple, age-appropriate language. Protect the child's privacy and maintain their dignity. Stay close and provide physical comfort when appropriate. Reassure the child that help is on the way, minimizing exposure to other children and bystanders. Obtaining consent. Respect autonomy while prioritizing safety. So conscious older child always ask permission before touching or providing any treatment. Unconscious young child, implied consent apply, act in their best interest. Parents and guardians' permissions, seek their consent when possible, but never delay if the situation is life-threatening. In some situation, you need to assess the situation as well. In some situation, you can get the consent, but in some situation, you can't. So you need to recognize the situation and make the decision. So resource and equipment management, making casualty comfortable, use blanket or jackets for warmth, provide pillows for support, use clean dressing for wounds if you're dealing with any cuts or anything. Position appropriately and recovery position. First aid kit management, know the location of your first aid kit. Check content regularly. Verify expiry date on supplies, maintain sterilized equipment. So I will just show you this is a handy first aid kit. It has pretty much everything in there. But probably in childcare you're gonna have little bit bigger first aid kit. So it has all the essential in there. So these are the band-aids, and then we got so these are the gloves to protect yourself. And then we got So we have like, so many things in there. So we got the burn gel, then we got like, some alcohol wipes in there. And then we got the one important thing in there. So we got the notepad and the pen. So you guys can take notes like, the date, time, location, what happened, what first aid was given to the casualty. And then there is a scissor. So why there is a scissor? So why there is a scissor in the first aid kit? So why there is a scissor in the first aid kit? So when you do the defib, so for the defib you cannot put on the clothes. Okay. So what do you need to do in the emergency situation? So like, if the clothes are too tight or you're unable to undo them, so you just get the scissor and you just cut the clothing. So that's why the scissor is there for. So, and this is the face shield. So when you're doing the breathing after the compression, so you can put this face shield on your face so you're not in contact with any germs like, going back in your mouth. And then there are like, some dressings as well. So there is like a rectangular dressing and like, different size of dressing, depend on the size of the injury you have. And then you have like, bandages in there. And there are like, some emergency contact details in here too. So there are a few things. So you need to make sure, so whatever the stuff is in your first aid kit, it have to have like expiry date on it. So you need to check like, regularly to making sure like, your first aid kit stuff is not expired. So just in case of emergency, like, they're ready for use. And then we got like cotton rectangular bandages. Then we got like, some saline water in there. And then we got like, some safety bit, like, just to put the bandages together. So this is how the first aid kit like, look like, but it depend on the service you're working at. Some of the emergency kits, like, they included like the fire blanket as well. So operating equipment, so AAD, follow manufacturer instructions, turn on follow wise prompt, attach pads correctly, ensure no one touches the casualty during shock. So where we can access the AED?
Actually in the marketplace, in the shopping center, in the medical center, in the hospital,
yes.
So in the community service, they have the AED.
So if you need to access the EAD, of course, like, you're looking after casualty. So while you're doing this the compressions and the breaths, you can send a staff member immediately to across the road, like, so the AED they can get, like, as you mentioned, like from the shopping center, medical center, hospitals, petrol station, they can access that AED. So EpiPen only if the train authorized. Remove from carrier, swing and jab into the outer thigh at 90 degree angle. Hold for 3 to 10 seconds.
Yeah.
So you have to have, I do have an EpiPen which I can show you. Sorry, just give me 1 second. So this is how does the EpiPen look like. Can you please show me? Do you know, like, how to use it?
So to use the EpiPen, the blue should be in the up and the orange will go in the thigh. So we have to remove the cap, sealed cap.
Yeah.
And we have to put it in the thigh.
Yeah.
So it can go over the clothes also. So we have to press it hardly. And wait for the click sound and count 1, 2, 3, 4, 5.
Yeah. So 3 to 10 seconds, and then you just rub off the area.
So
one more question: you guys need to be very careful when you administrating the EpiPen. If the person is wearing a very thick jeans,
yes,
it won't work. Or if the person has something in your pocket and when you jabbed it, it will just like the jab's gonna go in their wallet or anything they have in their pocket. It could be coins, it could be like anything. So before you administering the EpiPen, EpiPen, you need to make sure that you're doing it in the right manner, and there's nothing in their pocket and it's safe to do. So, continued care, monitoring and responding to changes. So, consciousness, assess responsive, alert and responsive, respond to voice, respond to pain, unresponsive, check people response, note any changes in alertness. Breathing, monitor breathing pattern, rate 12 to 20 breath minute is normal, depth shallow or deep, pattern regular or irregular, effort easy or labored, sound if it's like wheezy sound or rattling sound, look, listen, feel for change. Circulation, check circulatory status, pulse present or absent, rate normal, fast or slow. You can see with the skin color, whether it's pale, flushed, cyanotic, skin temperature, warm or cold, capillary refill, normal or delay, sign of bleeding or shock. Responding to changes and handover, adjusting treatments. Be prepared to move from first aid to CPR if breathing stop. Reposition in the child's vomit or choke. Maintain recovery position if unconscious. Continue monitoring until professionals' help arrive. Document all observation and changes. Clear handover to paramedics. Provide child's name and age. Describe incident and initial condition. Report all intervention performance. Share monitoring observation. Mention any allergies or any medical history of that particular child. So when we talk about the food safety and choking prevention, so food safety program, safe food handling prevent emergencies. So regular training on food storage, preparation and serving reduce risk of contamination and allergic reactions. Choking prevention, cut food into appropriate sizes, piece size for infants. Supervise all meal times closely. Avoid high-risk food like nuts, hard candies, grapes. Ensure proper chewings before swallowing. Keep children seated during mealtime. The next slide, we're going to be talking about the allergies, reactions, recognition, and anaphylaxis emergency response and procedure. So what is an allergic reaction and anaphylaxis response? So the allergic reaction recognize itchy or swelling lips, mouth, throat, skin rash or hives, nausea, vomiting or abdominal pain, difficulty breathing or wheezing. Notify parents and guardian immediately if you see any of these signs or symptoms. Anaphylaxis and EpiPen, life-threatening emergency. Administer EpiPen immediately if trained. Call 000 emergency service. Keep child laying down unless vomiting. Monitor breathing and unconsciousness. Be prepared for second dose if needed. Asma, just tell me, for example, if the child only has one EpiPen, and he requires another one because the emergency services told you that he requires another child's EpiPen. So are we allowed to use any other person's EpiPen on this particular child?
On that time, we can, for emergency, we can use that others EpiPen.
Yeah. So others EpiPen we can use it. And just one more things in regards to the EpiPen. So for example, if this EpiPen is out of date, are we allowed to use it?
Still we can use that.
Yeah. So with the EpiPen, yes, you can use it even if it's out of the date, because probably the medication is not going to work 100%, but it's going to work for some percentage to reduce the risk of the child's okay, so hygiene in emergency, hand wash before and after first aid, use clean gloves when available, prevent cross-contamination. So key takeaways and ongoing regular training, skills fade over time, refresh your knowledge regularly through annual CPR and first aid certification, workplace training updates, practice drill and scenarios, peer learning and discussion. Confidence through preparation, knowledge builds competence and confidence. Know your facility protocol, so you should know your services policy and procedure. Understand equipment location, so you need to know where the first aid kits are located, where the child action plan, their asthma plan, their EpiPen are located in case of emergency you need it, and how many children in your care they required EpiPen or asthma puffer or any kind of medication. Practice emergency procedure. Communicate with your team. If you're confused about anything or if you don't know anything, please reach out to your manager or your the first aid person in your center. So child well-being is first. Emotional security as well as vital and physical care. Calm, reassuring communication. Maintain dignity and privacy. So, do you think we can disclose the child's privacy to anyone outside of the service?
No, it's not. It's not okay to disclose the information of the service. Yeah.
Yeah. So you need to make sure, you're not talking to anyone, outside of the services. Provide emotional support after that shock or after that incident. You need to making sure, the child is okay. Follow up after the incident. So we always follow up and we always reflect back on our practice, what went well and how we can improve, or what strategies we can apply to reduce the risk of the emergency. Action item, what do you think this week? Check your first aid kit, verify content, check expiry date, and replenishes any used or expiry items. Locate emergency equipment, know where the AED, EpiPen and first aid supplies are stored in your facility. Review protocols, familiarize yourself with your facility emergency response evacuation procedure. Number 4 is schedule training. Book your next CPR first aid refresher course if certification is expiring soon. Be prepared, be confident and be safe. Your knowledge and quick response can save a child's life. Every moment of preparation today is an investment in the safety and well-being of the children in your care. So keep the children safe, keep yourself safe, keep everybody safe. So it is necessary, to up-to-date your first aid training. So before we go through any question, Asma, do you have anything you would like to know?
No, actually you cover lots of things, and even a few of the things I don't I forget also, but it's refresh my knowledge.
Yeah, so it's really important, to do everyday practice.
Yeah.
So, one second. I think there's one more slide. Test your knowledge. First aid assessment quiz. Purpose: assess your understanding of the core first aid concept and reinforce key learning points from this training session. So format: 5 comprehensive questions covering CPR, DRS, ABCD, consent, equipment and monitoring procedure. Outcome: we are looking for the outcome that you build your confidence in the first aid skill and identify any areas where additional training may be beneficial. How to approach this quiz. So read each question carefully and consider, maybe rather than you writing it down, we're just going to be going through it. Yeah, we can discuss. So discussion will be more beneficial, rather than we looking at the piece of paper. So according to ARC guideline, what are the compression to breath ratio for a single rescuer performing CPR on a child?
It will be 30 compression and 2 breath.
Yeah.
Yeah, and in every minute the breath should be 100 to 120.
Yeah. So, what are the 3 elements you should monitor continuously in casualty condition? CBC.
CBC. It's CBC. No, ABC or CBC?
CBC.
C is for, yes, C is for check pulse,
Yeah.
skin color,
Yeah.
and the temperature.
Yeah.
B is for the breathing, and another C is for consciousness.
Yeah. So when is implied consent used in first aid situation involving a child? So when you ask the child to get the consent.
Sometimes the child can't give us the consent. We have to ask them, but whatever the best for that situation, we have to accordingly do that. And otherwise, we have to do the phone call to the parents also, but we can't waste too much time.
Yeah, sometimes the enrollment form where the child get enrolled into the service, we already get the consent from the parents just in case of emergency. If we need to transfer or provide any emergency, treatment.
Yeah.
So we always have consent from the parents, but we always assess the situation. Name 2 available resources or equipment item you can use to make casualty more comfortable. So how you can make the casualty more comfortable? So the person is conscious, how you can support them to making sure they feel comfortable while you're
actually we have to if the person is conscious, so we have to respect and not eye contact. The person can't do the eye contact that time because he is unconscious, and
so
I'm
let's
not
have a
sure
look.
about that.
So
Yeah.
a blanket or warmth, pillow for support if available,
Okay.
clean dressing or appropriate positioning, so make them feel comfortable. Blanket prevent heat loss shock, pillows provide support and reduce discomfort. Clean dressing protecting wound, if they have any kind of cut or bleeding or anything. Proper positioning like recovery position, aid breathing and prevent aspiration. Any 2 or more of these resources demonstrate understanding casualty, comfort and principle. So what is the first step in the DRS ABCD action plan?
First we have to assess the danger. What's the danger?
Yeah.
And is it safe for me to approach on that situation? So first we have to assess that
situation. So let's go through the answers. So the first question, it was 30 compression to 2 births. So according to ARC guideline, a single rescuer performing CPR on a child should maintain a compression to breath ratio 30 to 2. This ratio ensures adequate circulation and oxygen. The compression rate should be 100 to 120, as Asma mentioned before, compression per minute, which compression approximately 1/3 of the child's chest depth. Conscious breathing and circulation, which we call CBC. So the CBC check is continuous monitoring framework for assessing casualty condition, which is consciousness, breathing and circulation. The third question we asked Asma, when the child is unconscious or too young injury to give explicit consent. So implied consent is used in emergency situation where the child cannot communicate. This includes unconscious child, infant and severely injured children. In these cases, it is assumed the child would want life-saving treatment instead of the consent. So number 4, we talked about how we can make the casualty keep them calm. Give them blankets, pillow support and clean dressing if there's any wound or any bleeding, and appropriate position to make them feel comfortable. So D is for danger, is check for remove any danger. In the first step in the DRS ABCD action plan is also assess manage danger. Before approaching the casualty, you must ensure the scene is safe for yourself, the children and the bystanders before you prevent the casualty. So before we end this session, Asma, would you like to add anything or any slide or any information would you like me to go through again?
It's okay, Amber. Actually, whatever you give me the training is so clear. And it's
So-
helpful for me also. Yeah.
Thank you so much, Asma, for your commitment to child safety, preference, confidence, and safety. Knowledge, your foundation of the confidence, effective response. Confidence, your training empowers you to act decisively in emergency. Safety, every child is deserves trained, caring adults who help them, people like you. You now have the knowledge and skills to respond effectively to first aid emergency in childcare settings. Remember, your quick thinking, calm, demeanor, and trained response can make all the differences in child life. So be prepared, be confident, and be safe. Next step is schedule your first aid training if it's getting expired. Review your facility. Ask questions to your colleague and your peers as well. Then you can do one more thing is practice and stay confident in your skill. Support your colleagues as well. And if you have any question, like you can send us an email on ravenhall@coolkidschildcare.com.au, or you can give us a call on 93605409, or you can visit us.
Okay, thank you.
No worries. Thanks, Asma.
Bye.
Bye.